Welcome everyone. This case is titled A Headache and a Finding. History. A 22-year-old presents with sudden onset worst headache of life. An MRI scan is ordered, and this is the image that you see. So with any MRI image, the first step is figuring out what kind of sequence this is. Is this a T1, T2, flare, or GRE sequence? So the answer is a flare sequence. If we look at the cortex of the brain, we notice that it's brighter than the underlying white matter. This pattern of cortex brighter than white matter is consistent with a T2 weighted image. The next step is figuring out if the CSF is bright or dark, because on a normal T2 weighted image, the CSF is bright, and on a flare image, the CSF is dark. Can you spot the finding in the image yet? So we actually have a mixed pattern here. Near the frontal lobes, we have bright CSF signal, but along the rest of the brain, we have dark CSF signal. So the fact that the CSF is dark in the majority of the picture means that this is a flare image, and the bright CSF signal near the frontal lobes is abnormal. We know something extra is there causing this incomplete suppression of the CSF fluid. What is it? Remember, CSF is basically water, so anything extra in that water, whether it be protein, pus, or blood, will cause an incomplete suppression on our flare sequence. Another option is this could be artifactual. So let's consider some differential diagnoses that would cause protein, pus, or blood within the CSF. You can get more simple proteinaceous material within the CSF in autoimmune conditions. Purulent material, such as in a bacterial meningitis, would also cause this, as well as blood due to a ruptured aneurysm. So what do you think it is in this case? It turns out that this is a case of artifact. You should always beware of incomplete flare suppression in the anterior bifrontal extraaxial spaces. Notice how symmetric this appearance is and its anterior location. Things such as protein and pus from inflammatory or infectious processes tend to be less symmetric in appearance than this. And remember, these are molecules heavier than water, so they tend to layer dependently within the picture, not anteriorly like we see here. So what process is causing artifact within this location? Well, remember that the flare sequence works by knowing the T1 recovery time of CSF fluid, which is basically that of water, which will also depend on the magnetic field that the molecules are seeing. So any distortion to the magnetic field will disrupt the timing of our T1 recovery for these molecules and therefore lead to incomplete suppression on inversion recovery imaging. Can you think of one very common thing that might distort the magnetic field within this location? How about dental implants? So this is a case of dental implants within the oral cavity disrupting the magnetic field just above this in the region of the anterior frontal lobes, which is why we see incomplete CSF suppression within this area. The one thing within our differential that's reasonable to consider is a ruptured aneurysm involving the anterior cerebral arteries or ACOM region, which would shower this region with blood, which would also interfere with our CSF suppression. This would also fit with a sudden onset worst headache of life history, and so the way to tease these two out is to check the other sequences. If this is due to artifact on the flare sequence, then the rest of the sequences should look normal. If this is blood in the subarachnoid space interacting with our signal, then we should see other findings, most importantly on the susceptibility weighted sequences that indicate that there's blood there. Also, again with blood, we would expect to see some of it layering dependently and not all of it hanging out anteriorly as we see in this case.